मंकीपॉक्स नहीं विश्व स्वास्थ्य संगठन सतर्क घंटी विश्व में मंकीपॉक्स व्यापीबा पर यहां अंतर्जातिक स्वास्थ्य इमरजेंसी घोषणा करिछि डब्ल्यूएचओ यहां पब्लिक हेल्थ इमरजेंसी कंसर्न घोषणा करिछि डब्ल्यूएचओ गत 2 वर्ष मध्य विश्व स्वास्थ्य संगठन गुरुत्वपूर्ण पदक्षेप नेबा सह मंकीपॉक्स को अंतर्जातिक स्वास्थ्य इमरजेंसी घोषणा करिछि एबे सुधा विश्वर 75 देश को मंकीपॉक्स व्यापिलाणी गत किछि सप्ताह 12 देश में 10,000 मामला सामना को आसिछि केवल आफ्रिका बाहरी चिन्हट होइछन्ति 16,000 मंकीपॉक्स मामला।
So, we're seeing nearly 70 countries affected by this outbreak. In previously affected countries, which are largely in West Africa, we're seeing communities of diverse backgrounds and ages. And in newly affected countries, we're seeing cases that are largely focused on men. And when we look at those cases, we're noticing that actually it's men who have sex with men, so men who identify as gay, bisexual, or who have sex with other men, who have perhaps reported through sexual health clinics or as part of efforts to reach cases through contact tracing. There have been some cases reported in women and children, but these have been very limited. And so we have to respond to the data. We have to really look at targeting our resources where we know the infections are happening. And at the moment, it's really happening within this particular group. While we're concentrating our efforts on gay, bisexual, and other men who have sex with men, we are also keeping a strong eye on the data to see whether the outbreak will evolve into other communities. There are multiple modes of transmission for monkeypox, including skin-to-skin contact, kissing, or touching infected materials like bed linen. What we know and what the evidence tells us is that sexual networks within communities of gay, bisexual, and other men who have sex with men have played a role in transmitting the virus in the context of this outbreak. So some gay and bisexual men are connected to these dynamic sexual networks that connect cities and countries. And in the early days of the outbreak, international travel seemed to play a significant role in further amplification. The community is active in managing its health. We know that many gay men actively seek sexual health services. For example, many of them will take HIV medications as pre-exposure prophylaxis to prevent HIV infection. And of course, some men are also HIV positive. So these men are in constant contact with health services. And through that regular contact and access to services gives them the opportunity to check up on any symptoms.